kind of.
For the most, okay, alright. So cysto stent is like the most basic procedure in a urology specialty. Sometimes most hospitals, they do cysto stent all day long. So, you guys know what cysto stent is? Why do we need a stent?
For drainage?
But why drainage?
There's a blockage in the ureter.
Okay. Or kidney stones, or infections, or strictures, or anything like that. Okay, so we're gonna do the demo, and pretty much you guys can come up close just to kind of look at this real quick. So this case is clean contaminated. However, most hospitals now, everyone is fully gowned. Okay, you guys might go out there and see some docs that just put gloves on.
Yeah,
but,
the older docs, they'll just wear gloves.
yeah, just cover, just the full PPE.
Yeah.
Just because there's urines, everywhere, splashing everywhere. Okay, so usually a set comes in with a scope. The scope is similar to our like laparoscopic stuff.
And this,
The camera and the head, everything is all very similar. Each facility have their own
so it'll
scopes
come like this,
and strings. Yeah.
and you have to put it together. So that'll go in here, and then it'll lock, and then check it to make sure it's locked, and then your scope will go in here, and there's usually, this scope doesn't match this, but there's usually like a little nipple on the scope, and there's a little
It sits in there.
hole right there. You'll snap the scope in,
Yeah.
and then set that there, and so it's ready when you're ready for
Yep.
it.
And we don't really have like a full set here, so
Yeah.
just we try our best to find one so that I can fit. And then a lot of times, so for cysto stent, we still do soft counts.
Yes.
Some facilities, they don't count it if it's a male. A female, we will
Yes.
count. Okay, but best practice is to count in every case. And this is something that we also count. We call this the nipple, the little suction that kind of goes up on here. Okay.
And that's just to hold the guide wire and
Guide
everything
wire
in
in,
place.
yep.
We'll show you guys when we get up there.
Yep, and then the set usually come with basic stuff like mayos, some couple cryos, and towel clamps.
Not much instrumentation with this.
Yeah, maybe an Asin to pick up stuff, maybe some Telfa.
Then you have
things
some
like that.
graspers.
Yep.
Grab stones, that type thing.
So you guys can see the tip. It's kind of like laparoscopic stuff, but it's just with different tips. There's scissors, sometimes there's a stricture. They would just go in there and cut. So this is like a Metz.
Whoa.
Yeah. And then there's just different kind of graspers and things like that. But yeah, so usually it has a basin. And
Some people like to use a ring stand. I don't like to use a ring stand. It's just more I gotta
More
worry
stuff.
about. So
Yeah.
I just unwrap my basin and put it on the table.
And usually we'll have sterile water and saline. Okay, so let's say usually in a cysto stent we need X-ray, we need contrast because we need to see the flow, right, of the ureter all the way up to the kidney. Okay, so we'll do the basic count, and the medication that you'll have is Omnipic, saline, sterile water. Okay, sometimes most kits they come in a 20 cc syringe or a 10. You'll have to ask the doctor whether they like half strength of Omnipic mixed with saline or full strength. Just it's doctor's
And
preference.
most of our docs will mix them and
Yeah.
then have half and half in one and then full in the other.
Yeah. So it's our job to ask the doctor every time. Okay. Same
Make sure
thing.
when you label,
Yep.
you make sure you label your stuff because we've had people mix up high pake and different stuff. So make sure that you label your med cups.
Okay.
And
Very
we're-
important.
Sorry.
Go
We're
ahead.
still doing 10 cc's in the med cups?
No, it'll be however many cc's of high pake and then
Yeah.
injectable saline.
Yeah.
Okay.
So,
We don't need much for this one.
yeah, like the doc will let you know
Yeah.
how
Oh,
much.
okay.
But usually it's like, I think it's like 100 cc's
Yeah.
of, usually the bottles, right?
The
Is that
bottle,
what you
whole
guys
bottle,
have?
yeah.
It's
50 or
it's actually
100,
on
something
back
like that,
order,
yeah.
but 100, so you'll get a full amount.
Oh.
So you want to make sure you keep track because that's going to be going for documentation at the end. The nurse will ask you how much Omnipic was used.
Okay.
Okay.
Just like local does, ask how much of the other
Yeah,
stuff you
so
use.
same thing. Just be very careful of, be aware, tracking the medications that you're given. Okay, so usually in the set it comes with, there's two type of drapes. I don't think we have the other one.
We have
The
an
closed-
LABH.
Do we have the closed rheology?
No, not the
I don't
closed.
think
No,
we
no,
have
no,
that.
no, no.
So this is like the standard setup: leggings, under buttocks, and then half sheet on top. And we will show you guys how to drape. Okay. And I do want to show you guys something. So with the underbutt, there's actually a little bag here to catch the fluids. So there's a little opening here. What I usually do is I don't make my circular crawl under the bed. So what I do is I actually pre-hook this suction up like this, and then I kind of just fold it back in here. Okay. What this will do is this suction will connect to the Neptune machine or suction device. Okay. So I usually do that for them. But if you don't, you can just pass it
Yeah,
off.
we pass it off to the circulator. They like to do it, so we pass it off to them and they just take care of it.
But yeah, this is pretty much the setup. It's very simple. This is a gravity saline irrigation that we will hook up to the bag. Usually it's gravity unless the doc asks for pressure bags. Pressure bag is meaning we put a saline into a pressure machine and it will just give you irrigation. But this is like this is the most standard basics. Okay. All right, so let's get started here. We're gonna back up over here. I'm just gonna. Oh, I have one. Oh, okay.
Hey guys, too, before we pull up, we would usually take the lube, put some on a towel or that little white thing that comes in your glove, in your down pack. Take some lube and put it on there because they're gonna need it once you get up there.
Yep. All right, so leggings. So we will each take one, and we're gonna come over here and help show you guys. Here on out, you guys gonna see some stuff that are in the gray area that we're not supposed to do, but you guys can see it out there. Okay. So leggings, we usually help with a doc. We're gowned, obviously. Okay. So your hand will go in here. Then you kind of just do the cuffing. Whoop, and then I missed it. Okay. So like that. Okay. In the real world, when you guys do DNC, this is the way that they do it too. We are actually fully gowned. Okay. We don't just put open gloving on. Then, underbutt. So just kind of let it hang.
And
Wow,
this
this is
shows
big.
you guys, the docs let us drape, they don't drape. So it's good to get familiar with draping this procedure.
Okay. So same thing. Okay. We always put the leggings on because we're sterile. Okay. Not the butt, underbutt first. Okay. And then the top is just a half sheet. And then we'll take 2 towel clamps and clamp it. Okay. And then that's it.
And I would be sterile, so.
Okay, so this one just hook up to. There's a stopper here to control the irrigation, okay? And same thing, you have the right balance.
And all that, yep.
Yep,
Can you still use like a razor?
yep, still the same, yep.
Oh, is the light on?
It's really dark.
It is. It's probably the scope though.
Yeah, it could be the scope.
There you go, Doc.
No, it's probably the scope.
Yeah.
We'll find another one. Okay, alrighty, so we're gonna get started. We did time out. Oh, you know why? Cause this, hold on, this fell.
Oh,
Let's try
come
that.
on.
Let's see.
Is that the right one?
Oh, that's better. Okay, so, all right. So usually they'll set it up like this. A lot of times the doc will just take like one wave tech. Sorry. They'll put one here,
Oh,
and
I'll
then
look
the
at
or
this
the and the loop. They'll loop it up for us. It's all looped over here. Okay. Now we're gonna get started. So, couple of things. Can someone open us that package?
With the red?
The red.
Oh.
Yep. So that's the Cysto stent. It comes with an introducer, a wire, and the stent.
I have
So-
a wire in here.
Okay. So that red thing that T is holding is the pusher to push the stent all the way in. Okay.
And I put these in my
You guys can
basin
come like maybe here.
because
so
we
you
have
can see.
sterile water in there, and when we're putting these in there, they're like dry, and we want them to be moist, because everything slides better.
Yeah, so hydrophilic.
So
Okay.
we'll just I just drop them in here.
Yep. And this type of wire, this is so, I don't wanna wet it, but once you
Yeah.
wet it, it's hydrophilic,
Yeah.
right? There's a straight and there's an angle over there, I'll show you guys,
So with this, before I even take it out, I'll take some of my saline,
and flush it.
take this, flush it. Okay? And
Okay.
then I do it to our pollock too.
Yeah.
Just the saline?
Saline, everything's
They have
saline.
like this,
Saline, yep.
this one doesn't have one, but they have this little blue thing on there. And it'll, it's like, it's clipped to to this plastic part. And you just take it off and they'll use it to help the wire go through.
Oh,
Yeah.
okay.
So usually there is something called a pollock.
Yeah.
It has measuring, where you can see when you go under x-ray. So when you go under fluoro, you can see, but we don't have that piece.
So we're gonna use that.
So we're
the
gonna use
pusher
this to
for-
pretend. What I can do is I can probably draw markings on it, but usually you can measure. A lot of times the stent, the size that the doctor determines is based on the patient's height, to determine how much of a long of a stent they need, okay?
So usually we'll start the procedure and stuff before we get the stent, unless the doc already knows what they want.
Yep,
So we'd have to go in, measure, and then they'll say, oh, I need this size stent. And then you tell your circulator, hey, I need this size stent.
yeah. You know what, I'm just gonna mark it. This is our pollock.
Yep, it'll look just like that.
And usually it's yellow or blue.
Gray, yeah, gray.
Yeah. Yeah. So that's our pollock. Okay, so,
You said pollock?
pollock, yep.
Or a
Mhm.
catheter.
Or catheter.
Yeah.
And that's the first step, cause you gotta measure.
Yeah, so you're gonna measure, and a lot of times they shoot, so they'll put in fluoro, so they can see the flow and where the stricture's at.
Yeah, but
Um,
they'll use it through the pollock though. There's a
Yeah.
cap thing like this on the end, and they'll just put it on there and shoot the high page in. So we gotta get this in first.
Yep.
So our pollock will be the first thing we
Yep.
go.
Okay, so now we're gonna go in here, we're gonna get started, we did timeout, so the flow will connect and there's an outflow.
Yep.
This outflow will just drip to the bag. And a lot of times they have to measure how much fluid was given inside the body and how much comes out. So, let's see if this, okay, let's just do that. So, we're
Would you
going
still
in here.
clamp the cord?
Yes,
Yeah,
everything
we
will
do.
be,
Of
yep.
course, yeah.
Mhm. Core management, so, oh wow, you can actually go in
Yeah, I
here
know.
this time. Okay, it's better than last time. So, now that it's in, so we can see, so I'll go ahead and I'll take the wire actually first.
You don't.
Can I, yeah, let me take the wire and I'll put that on to show them.
Oh, okay. That's
Yeah.
what you're saying.
So, and you guys, this little thing right here, this little white piece is called a cheater. Okay?
It helps you.
It helps you get into the little hole or the little opening here. So urology with wiring and vascular, endovascular is all very similar. That's why we're doing it on the same day
I might
because
have
it's
to
all the
wet this.
wiring system. Okay.
I might have to wet this.
Okay.
Can somebody grab the saline bottle, please? Just,
Back there.
oh,
But this is what it looks like. You'll go in the urethra and then it will go in. Then you can see the inside of the bladder.
There'll be a bunch of crumbs in there too.
Crumbs in there, fluids, urine,
I have
yeah.
a question though. Do we not use dilators for this? Would we realistically use them?
Not in cysto stent, not in the standard, unless they have a lot of stricture. Then in the urethra, yes, we will dilate. Yep. So this is what it looks like. There you go. Okay. All right. So as a tech, you'll help, manage the wiring part. Okay. Everyone hates the wires, so it flops everywhere. And this is the slippery one. I'll show you guys the stiff wires too. That is really the one that will like hit you in the face, and everyone gets hit in the face. So in the beginning. So you guys, so this goes in here. This wire, you need to always have a wire in to introduce it. Then you'll put your slider in, the next catheter. So this goes in. Then you gotta look at the camera. It should go in. So you see, right? Now we're in. Now go ahead and I'll take the Pollock. I think we marked. Is it the okay? Perfect.
Yeah.
Okay. So we'll take the Pollock now, which it has the marking.
Did it come on?
Did it wipe on your hands?
Yeah, probably.
Oh no, I see it. Yeah. So it's our job to keep this wire up to make sure it doesn't fall below. Okay.
All right, when you guys are doing this, your hands are wet and everything. I usually take my finger and do this. That way it'll go in easier.
Yep.
Marking side first.
Yeah.
Yeah.
Marking side because it's gonna go in the body so that we can do X-ray. And then it's very similar in vasculars too. And then I'll show you guys tip and tricks on how to play with the wire, how to feed the wire, how to advance, how to pull back. Okay. So now we're gonna go in. So this goes in, and you can see the Pollock inside. So you see the Pollock is in now, right? So now we're to a certain point now. Wire out.
Wire out.
Wire's gonna come out. Pollock's gonna stay in. That's how we introduce the next wire. Okay, and upsize. And the same thing, same idea.
And for my
concept in
wire,
there.
I'll usually just take a towel and just lay it over there
Yeah.
like that.
So then, T, what are you using with that blue?
This one just holds the wire.
Just holds the wire.
That's
Just
it.
holds
They
the
all
wire.
come in a loop like that,
Yeah.
otherwise
Okay.
it'll be a hot mess when
Gotcha.
we open it. Okay?
Okay.
So now the Pollock is in, so I'll take contrast. I'll do on the 20, half and half.
All right.
And usually there's a little connector on here.
I take injectable
Thank you.
saline.
And then so we will just, I'll find a connector. You
Yeah.
can just like connect it. It's a lure lock. Then you'll inject. Okay, we will be injecting contrast, and the flora will come, and then we can see the flow on the X-ray imaging. Okay. Now that I figure it out, we're gonna use that stent. So I'll go ahead and I'll take the stent wire. And a lot of times, depending on the surgeon, they'll use the same wire again,
Yeah, they
or
might
they'll
use
use
the
that
same
one. And is this long?
No, it's not long enough.
Okay, let's try that then.
All right.
We'll just use that one. So I'll take the wire back.
Okay.
But
And you guys,
either
if you
or.
happen to take this wire out, if you notice,
Yes.
this end is really flimsy and this end is really stiff, more rigid. You want to give the doc the flimsy part, okay? If you get mixed up.
Okay. Take the wire. Okay, the wire's gonna go in. Okay, we're in. All right. Go ahead and hold on to the wire.
Got it?
Okay. I'm gonna take the Pollock out.
So now sometimes Sherry's doing it up there, but she's pulling, so she's pulling the Pollock and pushing the wire.
Yeah.
Because we don't want to pull the wire out.
Yeah.
Okay, and we usually do that. So
Okay. So I'm gonna advance it until I'm out, and you can pull out. And communication in
Yes.
endovascular case or cysto or wiring case is very important because you gotta let the next person know that's helping you. Okay, I have the wire.
all right.
Go ahead. Okay, and then we wanna make sure this wire stays in where we want to locate or put in the stent. Okay,
I'm gonna leave
So now-
strings, but you would ask strings, no strings.
yeah. And the strings, you guys, some surgeons, they'll use a string. So
Yeah.
stent is temporary, right? You have to change it out every couple months. So this string part, some surgeons, they prefer to hang it out the urethra. And then they'll do a tegaderm and kind of tape it on the belly or lower, belly part. Some surgeons, they like to cut it. Then you'll just pull it out and it's just a stent, okay? So ask them before you load this up. Okay. And then now, some of the stent, which I'll show you, I'm not sure which one we have. This
Yeah,
one.
this one doesn't have.
Some
the,
of them have a narrow head.
Yeah.
So that would be going in first.
Yeah, it's just
versus the thick
right
side.
there.
Okay.
And then some of the other ones have like these black rings, and they go like 1, 2, 3. You can tell which side's the first one because they'll start
Yeah.
with 1, and then it'll have 2 solid black lines, 3 solid black lines.
Yeah.
Okay, same thing. This curls up on you, and usually you have to wet these.
Yeah, and there's a cheater too that we lost. We don't have that piece.
I don't like that. It's really dry.
Got the wire?
Is the string falling
Yeah, I got the
part of the
wire.
gray area?
Huh?
Is the string falling part of the gray area?
They would have
It will
that,
go
yeah.
with, yeah.
Yeah, it will go with.
Yeah. Usually there's a cheater on
Yeah.
here that folds this stringer
It's right
inside
here.
it.
Oh, okay.
Yeah. And there's
Yeah.
actually another longer one too, but okay. Hold the wire still. Okay. Okay, so
The
now,
wires just to pull the stent in. What you
Yeah, it's just a guide to stent.
all right, you guys. So
Okay.
now, hold the wire.
Wire out?
Not yet.
Okay.
So now, you guys look. Now the stent's gonna go in
And
there.
if you notice, I'm keeping this wire taut right here, so it doesn't push in while she's pushing the stent out.
Oh, okay.
So I
And
just
you're
pinch
just
it next to
holding
here,
it
yeah.
up.
You know what? Hold on. Can I have a wet ray?
It's not working here.
It's too sticky. Can you just wet something? I'm gonna wet it. And usually, guys, it's very wet. So.
Yeah, I would have everything soaking in there.
This is
so.
just not wet enough that it's not working. Okay, let me feed it in again. Okay, let go of the wire. Let me see here.
You good?
That's much better. Okay. Maybe this isn't going
That's right, for sure. It's still not going in.
in. It's coming. I think it's coming. It's very stuck. What I'm gonna do is I'm gonna take this out. I don't know if you guys can see the stent. I know.
Yeah, when it's not
stuck.
wet, so you guys have to get these wet.
Okay, the idea is the stent will be in here. Okay, it will be in here. Now the next one will be a knot pusher.
Okay, because the stent, we can't push it all the way up where it needs to be, so now we have to have a pusher to help it go up further. Usually the silver part is the top part for the pusher.
Let me see it. Okay.
You got it?
Yep, got it. Then this part is going to push all the way in. I think it's stuck in the scope.
Yeah.
But the idea is this will push the stent all the way into where it needs to be. Okay? And then now, after the stent is in, go ahead and wire out.
Wire out.
Yeah. And then that's it. That's
Go.
Cysto stent.
Yeah.
Yay. Yep. And then to pull, I mean, this just comes out.
Wait, so when would you have possibly used these?
That's if we have a stone or something, or a blockage
Yeah.
in the ureter.
Yep.
And we need to go in there first. Sometimes they'll put the pollock in and it'll get stuck.
Mm-hmm.
And it's because either there's a stricture, a stone in the way, or something like that. So we'll use these graspers to pull it out. Sometimes we have a stone basket over there. Want to show them that real quick?
Yeah.
Can you hand me that big package over there? It's underneath.
Yeah.
Yeah.
Or you guys, sometimes it's a stent exchange.
Yes.
That's what they'll do.
Yeah,
So
you-
if the surgeon didn't put the string in, they will be using the grasper. Can you give me one of the graspers? I'm just gonna show them. So the idea is you're gonna help with this side. This might be too big.
Yeah, 'cause I
Oh,
did,
that's
yeah.
too big. Too big. We have a
Is it
smaller
too
one.
big?
Yeah. So this is a flexible. This just goes into the nipple, and then it just feeds all the way in through to the front, so you should be able to see it. See? And then we will just grab it and then pull it out. Okay, and the old stent will come out. A lot of times, the old stent might be a specimen too. Okay.
And this right here is just our basket. These little, they might use this. They'll use this double one for the wire and one for whatever else they want to put up here if they have double lumen wires or something like that.
Okay.
If they need it.
If we use it.
Okay, so this basket, you guys gotta come a little closer. So on here, it says close and open, right? If you look at the very tip, when it's open, oh. See how it opens up? So what they'll do is, a stone is right there, they'll grab the stone, they'll say close, you close, and then we'll pull it out.
Yeah. And then they will let you know. So
Yes.
normally in the cysto room, you work with the doc, right? It's just you and the doc, and doc needs your help. Either you're up here holding the scope, or you're doing this part for them. Usually we're up here.
Doing this.
So it's very important that, so for example, when I say open, you'll say open.
Open.
Close,
I always repeat close.
You always
yeah.
repeat whatever the doc says, okay? Sometimes they'll do laser and crush the stones first, and then use this to get the smaller pieces out. Or it could be a foreign body, or it could be anything. It could be just pieces. You'll also see the similar stuff in vascular as well, okay? Anytime there is endovascular wiring, so EGDs, which I'll show you guys later on, everything has the same concept with wirings. They're same kind of graspers, same kind of scissors, same kind of biopsy forceps. They're all the same, okay? So now let's, we can try to feed it through and just to see, just to show them. Okay.
The basket is operational. Sometimes they don't
It's
work.
falling apart. Okay.
So no, we're working.
All right. So, so make sure the basket is closed, right? Because we don't want to like cut anything as we're going in.
Does that need to be wet?
This one,
This one, no.
sometimes, but not really.
Yeah. Usually everything here is wet already,
Yeah,
so
yeah.
it's very easy to get. I just don't want to make everything wet.
Would stone be considered specimen?
We
Yes.
use it.
Mm-hmm. Yep. All right. So let's see if we can get that open, and then close.
Close in.
Open.
Open.
What is that paper?
Dust.
Yeah, it's like fishing, pretty much. Oh,
Just
let's
that
get
big
Oh,
one
that
there.
one, that big one.
Okay, close slowly.
Closing.
You got it, Sherry.
Closing slowly, going
An
down.
arcade game.
Oh,
You get it?
Oh,
there you
Oh,
go.
you got it.
So, and then it'll come out. Sometimes
This
this
is
is
specimen.
How tiny
Okay,
is
this
it?
is specimen, and we'll just kind of, it depends on how they want to send it. Sometimes that goes into formalin.
Yep.
Okay? So it just, you gotta ask about these things. So that's the idea. Oh, I'm glad there's something, a piece of something.
Yeah, I know.
Something in there. So this is how it works. So you guys get to practice with this communication, and you know, we really want you guys to be comfortable with this, because a lot of you, I guarantee you the first week you'll get thrown into a cysto room and you'll do like 7 of these in a row, and you're gonna be fighting with wires.
And if you-
And that's
if
what
you
usually happens. Everyone
Right.
fights with the wires, and you know, this is just a slippery, and it will slip out just like that. You'll be dropping wires, and you guys get used to, you guys have a month, right, to get used to how to coil wires. I'll give you all the tips and tricks and how to, you know, manage your wires.
Yeah.
A lot of time for a difficult case, it's not just 2 wires.
No, it's yeah, I was
In a
just about to
vascular
say
case,
it.
in a vascular case, there's about 10 plus wires. So you guys need to know how to, you know, kind of coordinate. So we'll give you the tips and tricks how to get that, so that when you guys go out there, you'll be prepared.
How long should this procedure be? Roughly?
It depends.
It depends. It could be
'Cause if they
10
got-
minutes.
yeah, it could be
It
real
could
quick.
be long.
But if they got like a lot of stones, we got to get out. They got to use the laser and stuff like that. I've been in there 2.5 hours. Before.
Yeah, or TURP. How do you guys heard of
Yeah,
TURP? Yep. So those procedures can be really long. It just all depends.
Yeah. If they're
Yeah.
just putting a stent in, though, 10, 15
Yeah.
minutes, if that.
Yep,
Yeah.
and then with the TURP procedure, it's connected to a monopolar machine. So nowadays it's very easy. It's like a little loop. I don't know if you guys seen the textbook. It just goes in there and kind of shaves the prostate. Just like MyoSure when you shave the uterus. Sometimes people have like polyps and things like that. So it's all very similar concept. So when you do a hysteroscope, it's the same concept as you doing cystoscopy. Cystoscopy.
Cystoscopy. Just
Yeah.
kidding.
Don't say that. Cystoscopy. Cystoscope. Yeah.
Put us in new groups, and you just want us to run this first?
Yep.
okay?
Yep. Well, you don't like. I don't think you guys are gonna be out of time today, but I'm just saying when we assign you, we're gonna tell you. T can
Yeah.
explain to you guys
Yeah,
today
we'll
all your
explain the
assignments. So
board
when you
after
guys
you
come
guys-
in tomorrow, you'll have your assignments laid out and get into your groups, and you guys could just run OR.
Yeah,
all
it'll
day
have the
long.
procedure on the board, it'll have your group and which OR you're in.
Yeah.
And
Yeah.
then once we get used to running that, we'll have, cut times, time in room, cut times, and closing times.
Yeah. So you guys technically, so here on out, can you turn the light on standby for me? So when you guys come in, first thing first is to go scrub, okay? At 7 o'clock, you guys should be ready to roll. This is how it's gonna be at clinicals. Nobody's gonna wait for you. Nobody's gonna ask you if you scrub your hands. Like, you need to be ready at all times. So we're gonna pretty much turn to OR
We
schedule.
ready and scrubbed at 7?
Yep.
They,
Yep,
They
that's-
didn't unlock the doors till 7.
No, I'm just
Well,
saying.
when the doors are
when-
unlocked,
when the
first
doors
thing
are
we're gonna do
unlocked.
is scrub.
Oh.
My whole point is like you need to be ready before you go to the department.
Yeah.
So never go in the department and just not scrub and don't have gowns or anything like that. Okay. So for school, maybe on the shorter day it might be hard, but try your best. Go scrub first. So whoever's here, go scrub first.
Yeah.
So not everyone's lining up to go scrub. So first thing first, when you come in, put your bags down to go scrub. Okay. But yeah.
And
Okay.
then for your procedure times at the end, if you don't make your end time, your group stops there and the next group goes. So you guys have to be on turnovers and that type thing, okay?
Yeah.
And then whoever's charged, make sure when you're facilitating, hey, this group is about to come out in 10 minutes, you guys need to get ready, the next group, okay?
Yeah. You guys should work on teamwork. I know you guys already do. Turnover times. That's something that we look at in the OR too. Okay. What else? That's it.
Yeah.
Okay, let's go to the next room. We're gonna go do